beings. But you know, some of that stuff around, it's not a bad thing to have, right? So hopefully you don't need to use it for 20 years, but it's done. You don't have to think about it anymore. So that stuff can be helpful. And then there's the piece around, well, what does it mean to have to sit in this space? All right. So with prior to a scan, and she reports that none of the strategies are working, and she's, what do you reckon? I'll give you a hint, it's not that dissimilar to the strategies we talked about earlier. I've only got like 3 things, or 4 things. So often about, I'm yet to meet anyone who's not been anxious about their scans. And you know, often people might not consider me to be very serious, but I'll often say to people, you know, I'm happy for you to be the exception. Like, please show me how to do this. However, I don't think it's going to be the case, so let's make a plan. And I'll often talk to them about stuff like, okay, well, we know that the 72 hours between when you get your scan and when you get your results, you'll be beside yourself, so what are you going to do in that time? Rip out one of the garden beds and replace everything in it, or go away down the coast with the kids who are going to need to be entertained because it's going to be raining and you're going to have to keep them inside. What, you know, what's going to be your plan? Yeah. I mean, I think that space of going, and maybe this is my approach to life in general, right? And run away from this. You can work as much as you want to not be thinking about your cancer coming back. That is not what's going to happen in the next 72 hours. Let's just work with it. This is what it is. Yes and no. I think often in this space people feel really unheard. So, because they're well usually, like if you're 3 months down the track, you got your hair back, probably they're kind of back to doing normal things. So I think, you know, people's expectations of them is then, well, you're back to normal. And so normal's a really loaded term, right? But so I'll often talk with people around that idea that how do you communicate to people that you still need help?
So sorry for you, after like 6 months later.
Yeah, totally.
Everyone just expects you to go back to normal. And it's the 12-month mark or 6-month mark that you're still living.
Yeah, totally.
Just remind you so much of this.
Yeah, totally.
You get back into remission and everyone's back to normal.
Yep.
And how do you tell them?
Yeah, totally.
I still have an issue.
Yeah, totally. And people have short memories, right? You know, while you're bald and unwell, people can connect with that really easily. But yeah, it's often that kind of end time where people, and you know, and grief's the same, right? Like lots of the parents I see will talk about this kind of walking around in the world and no one understands them, and they know that no one understands them, but they can't communicate with them in a way that they can understand. It's a, you know, and this stuff is the same, right? Like, you know, people, I always think about it like kind of, you can kind of understand what's going on, but not really. People can follow the signs and they can get their way to their gate, but they don't. You just happen to be the unfortunate person that understands the language, right? The fact that you're standing there.
8 o'clock, so.
Yeah. Yeah. Okay. Yeah.
So I work in a medical setting as well. Some of my patients are telling me. And there comes a point where you just simply have to talk about death. I can't talk to anybody. Because if I talk to my family, they get all teary, upset, and they say, don't. You know? And depends on one's cultural and spiritual beliefs about what it means to be, to go through the journey of life. And there is evidence that suggests that if you do a spiritual assessment, if you look at their background, the way that they believe about life and death and the hereafter for some people who do believe in reincarnation, that really opens up another dimension to talking about those existential, kinds of things that are really important to these people that they would never speak to anybody about. And also the mismatch between the person who's the therapist and the client is I'm not even understand that.
Yeah.
And it is about, so one of my interests is spirituality and clinical practice and religiosity. And the research from I know about it from Toni and from other people for many decades is that it can be a very protective factor in both psychological disorders as well as in physical disorders. That's something wonderful.
Yeah, totally. There's all of that evidence around prayer and kind of prolonged life and
And the meaning they give, and often there's a lot of guilt, that, I was a bad person and I'm scared of, going to hell, or the other way around, because it's very sad as you, that they're hospitalized and you say goodbye to them on Friday and Monday morning you go and see them and they are no more.
Yep.
Often have patients who die on them, except for those of us who work with them.
Yeah, totally.
So I don't know, what are your thoughts?
A little while ago. So she was she kind of had a religion that had, her kind of connection to it had kind of waned a bit through, and it's not uncommon, at time of diagnosis people will disconnect from their religion because it's, some of that injustice stuff, right? Like how could this thing, in whatever that thing might be, kind of let me down in this way? Articulate it necessarily in that way, but people just tend to drift away, particularly young people, and that's part of that natural questioning of, who am I and what am I doing and all of that stuff. But I had so I don't not talk about religion or spirituality, and I talk a lot, part of that existential stuff is you often talk about these things, right? But I had this patient sitting in front of me a little while ago, and she, she'd obviously been working. You have a patient who's just dying to ask you something, and you see them and they kind of come in. It's like I just have to and invariably my young patients will work up to something and they'll ask me something really odd often. So it's like, what do you do on the weekends? It's like, oh, nothing really. If you're that interested, but we'd been talking about connection to God and spirituality. Her kind of the interface between her and the people around her who were all still really religious, apart from a couple who'd disconnected. And she'd taken great comfort that those people had actually kind of reconnected with their religion in the time since she'd become more unwell. And then she just kind of out of the blue turned around to me and goes, "You're an atheist, aren't you?" And so then we had that conversation. I know their families, it's very and so we had that conversation and I found myself having this kind of really meandering kind of explanation in a way that I wouldn't normally, where I was kind of like, well, I think that religion is a bit... And she saw straight through it. If that's what you are. And so we had this really open and frank, and it was really nice, right? And that particular young person, we had, that was kind of our last session because we'd kind of done all the work. And I actually, when she left, I thought, we're okay now. Because I was a bit worried that she hadn't really processed what it was going to look like for her to die. In the sense that she was going up in the lift and yeah. I said, "Oh, do you want me to come and see you, or you want to go back to sleep?" Because I knew that she would be just going to go back to bed. And she died on Sunday. but that was nice for me. And that sounds horrible, right? But that's a really, we'd done what we needed to do. And I think sometimes in this space, and this is what I was kind of alluding to earlier, lots of that grief that we carry is our grief to manage, because often our patients are fine, how do we write a patient looks really different, and my supervisor said to me a couple of weeks ago, she's like, as psychologists we're not very good at endings, and I'm like, I'm pretty good at endings. I like within earlier this year I think I had and they were patients I'd known for a long time, so currency, you get to be pretty good with that stuff. I'm much less good if someone just is like, I don't want to see you anymore. It's like, sorry? I don't know what to do with that. But yeah, I think it is an important piece to talk. And it's a space that, in our very well-boundaried selves, we don't talk about this stuff, right? Like that's one of the things we don't talk about. You don't talk about death, you don't talk about sex, and you definitely do not talk about religion. I think being in the health space when people are facing the end of their lives, you have to be a bit more open. Cool. All right. Do we have any more questions? I am going to do a shameless plug. I wrote a book. Progress. If anyone wants to find patients and you feel a bit stuck, don't know what to do, want to see them, or whether you should refer them back to someone if you want to know who. Cool. No worries.
So I just want to say thank you very much. Toni,
Yeah.
what's your email address?
It's toni.lindsay, Landsay, @lh.org.au. So if you Google me, you will find me.